Tuesday, June 23rd, 2020. Welcome into another edition of Talking Fitchburg. I am Jeremy Crosby, and yes, does this look familiar, folks? Do you feel the energy right now? Are you as stoked as I am? I am very excited and welcoming you all back here to the Talking Fitchburg studios. Jeremy Crosby alongside my trusty partner through all of this crazy time, Andrew Bamlett. Andrew, welcome back to the show. My goodness.
Hi. How's it going?
Right now, it's so beautiful.
I need to fix
how
my
many
camera.
months I've had to go without talking to you?
Yes.
Do you know what that's like?
I do, because I recorded all of them, so I know how it was, because I was still there.
You still had to live through the pain.
I couldn't be on camera. I could have technically talked, but it was a little more elaborate than here to do that. So,
and I would love to say that we're going to stay here, but that's not the case.
No, this is
some test trials going on, and as we work to get things back in order here,
and we're doing some other things after this, and so that's the real reason we're here. But we're like, hey, we might as well do the show since we're all together.
Fire it up. You had to dust off some things, put some gas in other things, and away we went. So very excited.
Had to restart some things, make it work again, but we're here. We're doing it.
Yeah. No, it's very surreal to be back, and yet it doesn't feel right compared to everything we've been doing.
Right? No, not at all.
But hey, appreciate all the work behind the scenes. I know it's not easy, and definitely happy to be back here.
Yes,
and doing
indeed.
it. And we're happy to continue to do the show. I mean, that's been the biggest thing is we started off pulling it back a little bit, doing the updates for the first couple of months, then started doing Talking Fitchburg again, and the update still happens. And I know we're still kind of in the different times here with the 6 o'clock airing of this show, but it's coming back. We're just bringing it back in, phasing it in.
Boom.
But the format hasn't changed. The guests haven't changed. I mean, we have great guests. We still get you the news, and Andrew still corrects me on when I say the words wrong, when I'm being dumb, and everything else in between. And you all have to know, too, that Scott is here today as well. He's right over my shoulder, and he can also correct me, which this is going to give me chills the first time he say that again. So, yeah, here we go. We do have a busy show for you today. We'll get you updated on the latest headlines as we kick off here this Tuesday evening, and then a little bit later here we'll be talking about COVID-19. We're checking into the data from last week. The numbers were trending upward nationwide. We're seeing some of those numbers trend upward. We'll take a look at that and see what those numbers actually say here from Dane County, Madison Public Health. And then we'll check in with my friends at Department of Ag, Trade, Consumer Protection. We're talking about rentals. If you are somebody who, whether you're the rentee or the renter or person that's helping keep everything going, the landlord. We'll break it all down for you. We had some adjustment time. Some of those periods have ended. Michelle will be here to talk us through on keeping everybody up on their rights, knowing what's going on here, and resources that you can use to understand the different laws about the forgiveness of paying things and setting up payment plans, all that stuff. So looking forward to sharing that with you. But first, we do turn our attention to the headlines, and we're starting with a spotlight. Fitchburg Police Department starting a spotlight series. Last week, Fitchburg Police Department officers responded to the West Side neighborhood for a call of a man who was yelling at the neighbors. The caller had witnessed the man in an argument with another person prior to him yelling at neighbors, which prompted a 911 call. Officers arrived on scene to find a man standing partially dressed in the middle of the street, still agitated and distraught. For nearly 45 minutes, officers engaged in dialogue with the man from a distance and attempted to work with him to find the different types of assistance allowing for a resolution of the incident. During the course of that conversation, the man admitted to being under the influence of controlled substance, confirming the likely cause of some of the behaviors officers observed. Officers continued to remain calm and de-escalated the situation while they worked to determine a resolution. During a pause in their interaction, while the officers were working towards a resolution, the man stripped to his remaining clothes off and stood nude in the street. Recognizing the man was possibly also experiencing a medical or mental health crisis known as excited delirium. Officers summoned emergency medical assistance to stand by. Officers began speaking with the man again in an attempt to get him to comply with the request so they could take them into protective custody. The man asked officers to arrest him, but then arresting officer efforts to take him into custody, so he kind of resisted that. A few moments later, officers were able to place the man into protective custody. Paramedics were waiting nearby, where quickly began medical attention and provided care. The man was taken by EMS to a local hospital for additional care. Why are we sharing this synopsis? Because of a member of our community were involved in this incident, some of whom were understandably frightened by the man's words and actions. Other members of our community may have witnessed portions of the incident without any context or understanding what occurred. And we are also sharing this incident to highlight some aspects of the response to issues involving mental health. With a high volume of mental health related calls for service, a significant amount of work has been completed by members of our department to address concerns related to mental health and members of our community. This work has resulted from recognition that while we are not trained mental health providers, we are often the first and sometimes only responders to those experiencing acute or long-term mental health issues. And it says here as well, as such, we have made significant efforts to acquire training, implement structural and procedural changes, and partner with community service providers. Highlights of these efforts include nearly 30% of sworn officers have completed work-along program in the crisis intervention taught by the National Alliance for Mental Illness. Personnel have completed training comprised of Department of Crisis Intervention team. Fitchburg is one of 2,700 communities nationwide to have such a team with a focus on developing relationships with those in need of mental health services, and a lot more great things happening behind the scenes. It's nice to kind of hear a situation and talk about it. And it says, in closing, we want to take this opportunity to recognize our personnel who responded in a professionally handled last week's incident. The personnel involved exemplified our expectations of service and in the components of our response to those experiencing a crisis. Thank you for your time and to learn a little bit more about us, and we look forward to sharing and learning more in the future. So that's what this is all about, is kind of breaking it down and showing you kind of behind the scenes. It's what's happening with the Fitchburg Police Department. So glad you're able to listen to that and hear that story. You can read that whole story online. I will share the link for that. All right, other news, senior transportation engineer job opening. It is official. Person in this position moved up to the public works director, so we're looking for a senior transportation engineer. Come join our team. Bill Balke, nice guy up there. He'll get you started once you join the team. So head out to the website fitchburgwi.gov for more information. All right, FDA advises consumers not to use hand sanitizer products manufactured. I don't even know how you say this word, Andrew, that company. Any Ask Biochem? Yeah. Either way, they've got a list of things here, and it says FDA advises that consumers not use any of the hand sanitizers manufactured by this company due to the potential presence of methanol, a wood alcohol, a substance that can be toxic when absorbed through the skin or ingested. FDA has identified the following products that are manufactured by this company. So if you do own any of these, you're asked to dispose of those immediately to protect yourself, and you can check out the full list. We'll get that posted up for you, but we want you to stay safe in case you did buy one of those hand sanitizers. A lot of companies making it now, so good to see that we're also tracking that and make sure that everything is okay out there. All right, drug take back. Medicines that sit unused in the home and cabinets are highly susceptible to misuse and abuse, so Secure Your Meds is a safe location out of reach of children until you can take them to a drugstore or take back box in your community. I bring this up because the city of Fitchburg does have a med drop-off box. It's at the Fitchburg Police Department. It's still accessible. Just set up an appointment. You can call the Fitchburg Police Department. That information is at the website, fitchburgwi.gov, and we will have a drop-off event coming up here in the month of July if everything works out. So wanted to throw that in there so you know that it is coming up. All right, and finally, we're going to head to the Better Business Bureau talking about roofers remain on top aimed COVID COVID-19 pandemic. And I want to break this down for you. How to spot a trustworthy roofer. So we see a lot of people have been doing a lot of projects around here with the extra time on their hands. I included. Andrew too. Andrew's done a lot of great work at the house. But roofing is something that you want to make sure you find the right person here. So check on their reputation. Trust matters when hiring a roofer. Consumers turn to the BBB.org more than 17,000 times per day to find a trustworthy roofer, making roofing industry the highest searched of all. Customers accept accelerated roofers to deliver on high quality and exercise integrity. Also, customer reviews and references. Yeah, with consumers spending nearly $8,000 per roofing project, reading reviews and checking references is a necessary first step. So see if the business honors promise and is responsive to customer questions. How about transparency at number 3? Shop roofers who are transparent about their business, its location, policies, refunds, and services provided. Ensure the company is advertising honestly by getting contracts and agreements in writing and safeguarding privacy. And finally, covering our coverage in quotes, 40% of BBB complaints and customers' reviews reference a leak. Warranty insurance claims often cover damages versus leaks in their policies. Contractors can build trust by providing a quote and being transparent with their customers. In licensing and insurance, legitimate businesses are licensed and insured by using an accelerated roofer. Customers can be confident that the business meets all of the BBB standards for trust and embodies integrity and honesty. Good information to share there, as maybe you are working in on again, updating your house and whatnot. It's something you can check out. I'm sure, too, Department of Ag, Trade, Consumer Protection's got a lot of information out there, too, on checking out roofers. All right, that does it for our headlines. Coming next, we open up the digest. We're talking about COVID-19. Take a look back at the numbers last week. Find out why they're on the uptick. That's next right here on Talking Fitchburg.
Play Eric Amarola's Race Day Mix.
I don't remember how it started.
Go to that.
Our back and forth. It always came back.
Dad!
You probably don't remember what you told me,
That was perfect.
but I heard every word.
Welcome back into Talking Fitchburg. Now onto the digest segment, and today we're talking about the COVID-19 pandemic. We're going to take a look at some data put together by Dane County COVID-19 statistics, data, everything you wanted to know about it. And it goes back to the dated June 6th through June 19th was the snapshot that they took here. We had talked about this earlier this week, well, yesterday, that the numbers were up over the weekend and trending up. Now, I don't know if the holiday week a couple of weeks ago, we have Memorial Day weekend, more people getting out. It's been nicer out, so people are getting out more. So we wanted to go through kind of some of the data here on what it's looking like, what they look at here, and as far as things moving forward. So we had talked about this when we were talking about the Forward Dane plan and the reopening status here. So this is showing you some of those measurable pieces, both from the Dane County side of things and from southern Wisconsin. That first one there, threshold of 5% positive tests as a percent of the total test average across most of the recent days, was at 1.4%, below low threshold of 0.71 new cases per 100,000 people per day. This is below 4 cases per day for Dane County and 8 cases per day for the southern region. Testing supplies and staff facility, a lot of it there on the up and up, and percent of hospital reporting still at the 100%. Percent of hospitals reporting eligibility to treat all cases without crisis care at 100%. That's good to see. Decreasing or stable numbers of infected healthcare workers. We got the check marks there. I'm not sure the check marks. That's a good thing. I would think. And all positive cases being contacted quickly to facilitate rapid isolation and quarantine for disease control. They don't have any tracking data on that, but at 82% tracked here in Dane County. In proportion of new cases over the most recent 14-day period who don't know where they could have gotten COVID-19. It's 33%. 7% of the cases have missing data, though, so keep that in mind. That's kind of a startling piece there, though, that people don't know where they're getting that from. That's where we're starting to hear about that community spread. And as far as the downward or stable trajectory, not happening here in Dane County. Cases had been going up. So looking at the data here, and we were kind of focused on this yesterday, but in the 14-day period, 66% of the cases were younger, and that was between the ages of 10 and 39. So very startling there. We knew that the most vulnerable population had the most, we've been talking about the most, but for the people who were affected, those cases, the new cases there, that's very young. 43% of the cases were tested at community test sites at Alliant Energy Center, so that's good to hear that the testing people are going and getting tested. 21% of those cases were associated with a cluster, 22 from congregate facilities, and 18 from businesses, 6 from daycares, and 5 from other clusters, such as gathering outside of Dane County. 70% of these cases were asymptomatic, meaning they don't show any symptoms when they're out there. So definitely a good reason why we need to continue to practice social distancing, wear masks when we're out in public places, and making sure we wash our hands, use that hand sanitizer as much as you can. So the average of the 1.4% of the tests were positive, which was below desired threshold. So this is kind of looking at that week and where that percentage is at. And we want to be below the 5% line, so still well below on that front, but you saw those numbers again increasing up in the weekend. There was an average of 17.2 cases per day, which was above the desired threshold, so you have where they want to be, and again, these were definitely on the up and up, so we're at the 17, which is yellow, which is 4 to 20 cases, and then just moving down the way here, you've got the average of the 1,207 tests were conducted each day, which is above the desired threshold. So we're still getting a lot of testing done here in Dane County, which is good. If you need a test, you can get a test at Alliant Energy Center. Make sure you get out there and use that. We've been trying to promote that as much as we can. And then we've got the measure of the hospital piece, which we had already told you was at 100%. Good to hear on that. And here is the significant increase in numbers of healthcare workers who were tested. So this was talking about it. There was the check mark we were talking about, no significant increase in cases, which is good. We need those healthcare workers to stay healthy as we move on. And you can catch this whole report. We'll post up the link. Andrew, I'm telling you, post the link up to this when you post the headlines today, okay? And we'll get that out there for you. All right, that does it for our digest. Coming up next, we open up our guest segment, checking with our friends at Department of Ag, Trade, Consumer Protection. That's next right here on Talking Fitchburg.
When I was in foster care, I never knew when I would have to move, so I always had my suitcase ready to go. Then one day, I was adopted. My new parents opened their hearts and home to me. My parents cook my favorite breakfast for me every morning. My parents take me on trips I never thought I would go on. They gave me a home and an even better reason to use that suitcase. My parents aren't perfect, but they're perfect for me.
Find good stuff at Goodwill and bring good home. since the pandemic and the stay-at-home order began, Wisconsin had a moratorium on evictions for the inability to pay rent. So landlords were unable to evict tenants if they were unable to pay rent. In addition, they weren't able to do inspections of properties and come in and do showings at properties. And with that order having expired, the stay-at-home order, landlords can now go in with proper notice and do inspections. The moratorium on evictions has also expired as of May 26th at 8 a.m. And what that means is that landlords have the ability now, if a tenant has not paid rent, to proceed with the termination of tenancy notice and then proceed trying to get a writ of eviction through the courts. They can take their tenant to court and try and proceed with an eviction. And so those have both ended and expired, and we're back to, in those frame of reference, a normal state of affairs, if you will. But what's different now in what could assist tenants who may still have economic crisis, and same with landlords, is that there is the Wisconsin Rental Assistance Program, or RAP. And this is a program that could provide assistance to eligible renters who've had this significant loss of income due to the COVID-19 pandemic. And one of the features, if you qualify, is that the payment will go directly to the landlord. So if landlords are in a position where they are not receiving rent from a tenant, they may want to work with or talk with their tenant to see if they've applied for this, because it could really help both parties out in this case, because the tenant could potentially stay in the property and not be evicted, and the landlord would receive their rental payment as well, which of course those landlords need that. There are some basic application guidelines, and they include eligible applicants must be an adult, so Wisconsin resident with a household income at or below 80% of the county median income in the month prior to the application date. So that's kind of confusing. But then there's eligible costs include both direct financial assistance for rent owned and security deposits. And then rental assistance up to $3,000 per individual could be available. So again, that's that rent and security deposit combined. So the RAP program, or Wisconsin Rental Assistance Program, is really something that could provide great value and is new. Again, it's something that's just started in the last few weeks, and the applications just being available in the last week or so. We want to make sure the word is out for both tenants and landlords, and it's a program being administered by the Department of Administration. So really, everyone should be looking into this if they are still in a position where they're unable to make their rent payments. If tenants aren't eligible for this and landlords are questioning, what their next step is and do they want to evict or how can they help, we've said from the beginning, communicate with one another. Be sure that you are talking. Maybe you can work out some other kind of payment arrangement, but then make sure you document that as well, because that's an advantage to both the tenant and the landlord to have that documented and written down so both understand what the expectations and new agreement is. Things that usually are important to make sure both parties understand is what is the new arrangement or agreement? How much is going to be paid? What interval will that payment be made at? What's its new due date? What's if you're allowing kind of an extension of time, what's the new full payment payback period? Who will be making these payments, or what's the responsibility there? So the other important change that was made and is still in place factors into these new agreements. The Department of Agriculture, Trade, and Consumer Protection went through an emergency rulemaking process. And as of April 26th, I believe, maybe it was the 25th, losing that date there, So the department went through a period of emergency rulemaking, and as of April 25th, landlords are unable to charge late rent fees or late penalties to a tenant if they're unable to pay the rent or if they're only able to pay a portion of the rent, and that goes until August 8th. So that's an important factor in all this, in the fact that if you're making a new arrangement, or even if you have your current existing rental agreement and it had a provision for late fees, landlords can't charge those right now. They can't accumulate. If a tenant was late with their rent in April and they had a late fee issue as part of their rental agreement, they can go right up to the 25th with whatever that agreement was and apply it. But as soon as April 25th came, the emergency rule went into place and landlords wouldn't be able to do that. Now, again, this is not a waiver. This is not any kind of pass for tenants to pay rent. They're still responsible for rent. Again, the moratorium on eviction has expired, so if they don't pay their rent, they run the risk of a landlord taking an action to evict. There is the RAPS program as a point of reference, but if a tenant isn't eligible. So these are all factors and considerations in this relationship that landlords and tenants have, and should make sure that they are in communication, trying to work with one another and documenting whatever new agreements they come to, but make sure they're working within the provisions of the laws that exist today. So the agency has on its website frequently asked questions related to landlord-tenant issues, what exists today, what protections, what programs, what resources are out there for landlords and tenants, and links to those. So go to our website at datcp.wi.gov. You can access those in our COVID section of frequently asked questions. There'll be a landlord-tenant component. We also always have available our landlord-tenant rights and responsibilities and our landlord-tenant guide that would be valuable for consumers to reference. But you can also reach us and ask questions on our consumer hotline at 1-800-422-7128.
I'm heading out, man. You want to ride?
No, I got my car, but I actually really need to go to the bathroom.
Dude, are you okay?
I am definitely buzzed.
Yeah.
I think I will take this, and I will take that ride home.
Your dollar is worth more than you think. In times of trouble, your dollar can provide exact items that disaster victims might need, such as water, food, and clothing. Material donations can be more expensive due to port costs and custom tariffs. Donating cash is quicker and more effective in helping those in need. George here thinks cash is definitely best.
1 in 3 adults has pre-diabetes. That means it could be you. Your barber. Your barber's barber.
Nice work.
Thanks.
With early diagnosis, pre-diabetes can be reversed. Take the risk test at doihaveprediabetes.org.
Welcome back into Talking Fitchburg. Wrapping up the show for today, I want to thank Michelle from Department of Ag, Trade, Consumer Protection for checking in with us and providing great information. Head out to our website, and you can get everything you ever wanted to know for consumer protection items. Or our friends at the Better Business Bureau, too. They've got some great resources for you as well. As we wrap up the show for today, I want to remind you to stay connected with Fact TV. Andrew knows that it's free, but do you? Yeah, we're out there. You don't just need cable to watch us. Yeah. Apple TV, Roku. Best HD signal I know of. Check it out if you haven't already. We've got our Com channel and our Gov channel out there. Facebook and YouTube posting up the latest videos, including government meetings on YouTube. We're doing that. Of course, they do come up to the website a little bit faster, so head out to the website, fitchburgwi.gov, where you can check out the latest videos posted, schedules, and more. Hey, have a great day, everybody. We'll see you back here tomorrow. Stay safe out there.